We all know that wine is not good for our skin. Wine is associated with two main skin symptoms, such as facial flushing and redness. In addition to that, it is known to cause or trigger a variety of skin conditions such as acne, rosacea, eczema, etc. What are the specific of wine's influence on our skin? That's today's topic. Welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and IFM-certified functional medicine physician. Today, we will be talking about components of wine that do have an effect on our skin. First of all, one of the major components is histamine, and I'm sure you've heard about histamine, so a few words. So the histamine occurs both naturally in our body, but also it occurs in some foods. In wine, histamine occurs as a process of fermentation. So when during fermentation, bacteria converts amino acid called histidine into histamine. So histamine is present in both white and red wines, but there is more histamine in red wines. And histamine is responsible for this vasodilatation, which is widening of blood vessels on your face, or a typical look of somebody who's had too much wine. So, and there are people who are sensitive to histamine, and there are two ways that you could be sensitive to histamine. One is just you're sensitized to histamine, because, and the other one is because you have too much histamine. And why would the latter scenario happen? It would happen if the enzyme that is responsible for breaking down histamine is for some reason insufficient. So, but sensitivity to histamine is very common, and there are different mechanisms for that to express itself in a variety of histamine disorders. Today, we're just talking about histamine and its effect on the skin. So, but there are other effects of histamine on other body systems. So that's histamine. The next component of wine, next components of wine are sulfites. So sulfites, they're actually used to prevent spoilage, and they help maintain wine's freshness and stability. Additionally, they have antimicrobial qualities. They inhibit growth of bacteria and yeast. And very importantly, also, they are antioxidants, which means that they prevent wine from turning brown and having strange taste. Most winemakers do add some sulfites, although they do occur naturally in small amounts. But added sulfites basically increase quality and longevity of wine. Organic wines do have less added sulfites. So the next component, which is important, is tannins. So tannins, they are present in the grape, in the stems, in the skin and seeds of grapes. And tannins give wine that astringent taste, and they do cause trigger migraine in people who are sensitive to wine, sensitive to tannins. So the next factor is flavonoids. So flavonoids actually are good components of wine. They are also they're present in the grapes, but they're also present in some other fruit, and they are responsible for anti-inflammatory qualities of wine, and they do protect against heart disease. Flavonoids give wine that purple red hue, that vibrant red hue. So now I'll just summarize the sulfites and tannins and flavonoids. So flavonoids are the good guy here, but sulfites and tannins, both of these compounds, they can actually trigger histamine release. Sulfites can indirectly trigger more release of histamine, and tannins actually can cause the enzyme that's breaking down histamine to slow down, they inhibit that enzyme. So at the end, the common denominator here is both of these compounds can lead to more histamine. So histamine is the key, and therefore the redness and facial flushing. So we have discussed the main component of wine, but of course we have not talked about alcohol. And there are not many, or actually none, of any good qualities or good factors associated with alcohol. So I will list some of the factors of alcohol's influence on the skin, since they're all detrimental. So we'll start with important ones. First of all, alcohol also can cause vasodilatation. So it can also cause redness and dilation of the blood vessels on the face and also on the neck. as well. So it's not only limited to the face alone. Additionally, alcohol is known, as you all know, to cause dehydration, and dehydrated skin becomes much thinner and more prone to formation of wrinkles. Alcohol leads to generation of free radicals that also lead to rapid or more accelerated aging, unfortunately. Alcohol is known to cause some nutrient depletions, very important for skin enzymes such as vitamins A, C, and E. And that, of course, takes away from the vibrant and luminous appearance of the skin. The next one is poor sleep. Of course, sleep dysregulation, dark circles under the eye. So that's a known effect of alcohol. Additionally, I want to stress out another influence or another action of alcohol on our body, that alcohol stimulates cortisol. And cortisol is not a good substance for our collagen, because cortisol breaks down collagen, and collagen is the most abundant protein in our connective tissue. Collagen is responsible for our skin health, for our joint health, the health of our blood vessels, etc. So essentially, alcohol is detrimental for collagen. And of course, the list goes on in terms of the bad effects of alcohol, but I think I'm going to stop here. So in summary, what are the problems with the effects of alcohol on our skin? There are effects through release of histamine, which is, of course, significant vasodilatation. And as we discussed, the manifestation of that would be worsening of rosacea. Additionally, histamine release is associated with hives. So people who are sensitive would be more prone to having hives after drinking wine, for example. Additionally, the other skin conditions, such as eczema, psoriasis, acne, seborrheic dermatitis, they all tend to be influenced by different ways, by different aspects of all of these wine's components. And at the end, there's increased inflammation, increased redness in all of these conditions. Basically, to summarize it in a simple manner, that drinking wine for many people triggers flare-up of their chronic conditions. So now they have an acute flare-up of a chronic condition. And some people, of course, have it more than others. So in summary, of course, limiting wine intake is a good idea, especially if you are sensitive to wine. Thank you so much for listening. Until next time. Bye-bye.